Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited to have a very special guest today, Dr. Amiethab Aiyer, also known as Tabs. And I will just let him tell us a little bit about himself.
Well, first off, Orkita, thank you so much for your time and willingness to include me on your, amazing podcast. I do sincerely appreciate it. A little bit about me in general. I'm an orthopedic surgeon practicing at the University of Miami in Miami, Florida, and my subspecialty focus is foot and ankle specifically. I've been here for about 5 years and a couple months, if you will, as my dad would like to appropriately say. And I've actually and this is my first job out of training. So I did my undergrad in California, then went to the Northeast for medical school and residency, went to Baltimore for my fellowship, and at Mercy Hospital up there, and then came here for my first job, grown-up job, if you will. And it's been a super interesting process, sort of developing my own skill set or cultivating it further, as well as getting to work with medical students and residents, watching their own progress too. The latter, the medical students and resident piece, is actually what sort of inspired me in a lot of ways in terms of developing, advising, and mentorship programs for them. And in not only cultivating their interest in medicine, but in orthopedics, and really trying to take some of that interest and grow it on even a national level. And so I've been really fortunate to be able to do that in a few different ways. So my practice is certainly not just a clinical one, but it's definitely influenced heavily by the work I'm able to do, not only with the students and residents, but also by the research stuff I do as well. So there's lots of different components to what my life is like now. And of course, most importantly, my family, my wife and I just welcomed a new baby, and so we're sort of kind of grooming her for all the most important job of being my kid, and the most important job to me of being her dad is really kind of allowing me to think about of what kind of role model, what kind of advisor, what kind of mentor, coach, if you will, that I want to be, not only for the purposes of my patients, but also for the people that I'm kind of serving as a teacher for. And so those are just some of the things that run through my mind in kind of describing what I do at this point.
I think that was a lovely description of what you do, and firstly, I want to say congratulations on the new baby.
Well, thank you so much.
You're welcome. And it's just fascinating. Like, I like to make small ties with people, and to hear that you trained in the Northeast, I did as well. And I also went to a residency in Baltimore. So it's just so fascinating how there are little 6 degrees of separation for people.
Right. And especially in the world of medicine, it's probably even like 1 degree really, right?
Absolutely.
Many times. And I'm sure if we tease it out, we probably would have mutual friends across some sort of like schooling or training or whatever sort of interaction. Yeah, it is incredible to me just how small the world is.
Absolutely. I'm almost certain that you're right, because it sounds like we're about the same amount of years out of residency too. And we share the passion for mentorship. So we'll definitely get a little further into that in our discussion. Perfect. But first, I want to ask you about what actually motivated you to pursue a career in medicine, because we have a lot of listeners who are pre-meds and thinking about joining the force. And I love to hear what inspired you.
Yeah, I think we all have a lot of maybe experiences from the standpoint of, something we did in high school, or maybe something we did in college or otherwise that may have been a driving force. Then, of course, there's the familial component where, hey, maybe an experience that we went through. And for me, that was certainly the big thing. So I actually lost my mom to breast cancer when I was about between 11 and 12 years of age. And, watching her, not from the standpoint, from the time she got diagnosed to the time, she kind of fell by the wayside to metastasis, kind of seeing her through that period of her life and the strength and resilience she had despite multiple rounds of chemotherapy, seeing the, even after the after effects of mastectomy, seeing, the way the, metastasis was sort of, taking her over, the force with which she still carried her, the vigor with which she still carried herself, and the life force that was super palpable, and my unfortunate inability to try to help her, even though I was a kid, that sense of helplessness was really what struck me as, I want to be able to go forward and help people. And, you would think that, oh, well, if you lost a parent or a family member to a given condition, i.e. breast cancer in her case, that maybe you would do something along those lines. And so I definitely was, I was really inspired by not only her, but, her experience, but also, I really do, enjoy, working with kids and obviously, now it's, hanging out with my daughter. And, that was definitely, I thought at that time I would actually blend, kind of find a nice, blend of the two and do pediatric oncology.
Mm-hmm.
But, when I got to medical school, it really became, and that was sort of my thing. I was going to do peds. I was going to do oncology. That was what I was known as in college. I was known as that in medical school early on. Then I actually got to my pediatrics rotation and realized that it just, I just didn't see myself doing it. And when I actually got to an oncology service while on the medicine rotation, I realized how much respect I had for those, for those clinicians, for those providers, and treating those patients. But I realized that there was still a part of me that's still, almost hurt in some way, and I just couldn't. I just didn't necessarily have the resilience to be able to push forward, down that career path. So, it was then figuring out, well, what the heck am I going to do now?
Mm-hmm.
I've been thinking pediatric oncology forever. I'm not going to do adult oncology. I'm not going to do pediatrics. So what am I actually going to do? And of course, I stumbled upon, surgery was my last rotation because I was like, I wanted to push it off till super late. And by happenstance, ortho was the last rotation. And of course, I pretty much had the eye roll. Oh, okay, ortho, whatever, because I hadn't picked, my elective on time. And the first time I saw a hip replacement go in, I was absolutely fascinated, like many people are when they're, kind of seeing that procedure for the first time. And, I really started weighing my options, both mentally and in terms of, hey, what was I in it for the long haul? Because obviously, going down a surgical pathway is definitely not a short period of time and requires a lot of, mental and physical commitment, all those hours spent in the hospital, as well as all the time spent thinking and learning and all that sort of stuff. So, at the end of third year, I made that decision to pursue orthopedics, and here we are. Now it's 10 plus years later, and I'm board certified. I've been in practice for for over half a decade now, and it's still as exciting as it was then is how excited I am now to not only do the cases, not only help the patients, but to try to help them, help them improve their quality of life, help them in at least the way that I feel that I can help them. And some days I feel that I'm doing exactly what I set out to do. And other days a little bit more tough, like we all have. But I'm really lucky and blessed to have been able to find a field that I truly could sink my teeth into, in the sense of not only be able to help people in the way I wanted to be able to help them, but to get to use power tools, as an example, which is obviously what draws many people into ortho. But again, be able to think about things in such a way that's just different than other facets of medicine, but not any more or less important. Just I'm able to do what I love doing. And that to me is one of the biggest things I can say about this specialty I've chosen is I really do love what I am doing day in and day out.
I love everything that you said, and you kind of brought out some really good points. Unfortunately, we have these life experiences, and I'm sorry to hear about the experience that you went through with your mother, but it shows that while you were experiencing that and taking all of the strength and the things that she was going through her process, you were absorbing what was happening and figuring out ways to help serve others in the future from your experiences. And you went into medical school with one intention in mind, but you kept your mind open and your options open.
Yeah.
So you could have gotten to your pediatric oncology rotations and been like, I've been preparing my whole life for this. I'm going to do it, even though it's not as fun right now. But you said, let me try more things. And then you took an assessment of yourself and you said, I waited a long time to get to these surgical rotations, but I love it. And this is something that I want to do for the next 30 years. And kind of took that and kind of made a turn. And I think that's important for the student to hear. While you may have ideas in your mind of what you would like to do when you enter, be open-minded and you may figure out that there's something else out there for you.
I think you're absolutely right that, a lot of times we sort of, especially when you're pre-med and you kind of have like quote unquote formula ahead of you of what to do to try to get into medical school or PA school or, go down the route of nurse or NP or CRNA, whatever it is, athletic training, and I think that it's having a plan is not unreasonable, but I think there needs to be just like in medicine, no two patients are the same. And even if they have the same diagnosis, exactly how they got there and considerations you need to think about for their management may be different. And in the same way, in surgery, we often, no two fractures are the same. So even though I think similarly about a lot of surgeries, there may be different adjustments I have to make. So in the same way, if you keep your approach to how your life and to what your career aspirations are, keep them super rigid, then your ability to make adjustments on the fly becomes challenging. And this is exactly where I would really truly say that you need to have some semblance of flexibility, because down the line, fast forward 15, 20, 30 years, when you're in your own life, when you are living day to day with your family, with, you've got personal obligations, you have professional ones. There is, and I don't even want to say balance, but you've got to find this sort of harmonious equilibrium or harmonious tension, if you will, amongst all these things, and find that sort of homeostasis for yourself. And that requires flexibility. We can't be rigid in our thinking. And I think that is, and I do think that is really important to understand. So you should, go to each rotation, each experience with, hey, I'm going to try this. And, if I like it, I like it. If I don't, I don't. But I would say, be a little bit different than how I was, just so you can do yourself the due diligence of thinking about stuff outside of what you may think you like. Because I never thought I was going to like anatomy. I never thought I was going to like surgery. I was like, no, it's not even for me. And then here we are. And the thing I spout off to the students and residents all the time is how important anatomy is. So, you never know how things are going to change and what curveballs life is going to throw at you. And your ability to, swing and hit, strike the ball with force and make gains, it's critical to be able to do that, based upon your ability to make adjustments at the same time.
Absolutely. Now, like you mentioned, you didn't discover that you were interested in orthopedics until pretty late in your educational journey. And orthopedic surgery is pretty competitive. Can you tell us about the process that you went through with the residency match?
Yeah. So first off, to anyone who's listening who may be applying right now, first off, good luck. It's a particularly tough cycle. So, my hopes and thoughts and prayers are with you. So definitely stay strong, no matter how well the interview release process is going for you or is not going for you. Just keep your head up. In general, for me personally, when I applied back in 2007 or 2006, 2007, I applied under sort of the pretense of, okay, hey, I had been given advice from the chairman at my home program. I had been given advice from other folks. I had pretty reasonable step scores, over 230, which was average to match at that time. I had no real research in ortho for sure, no real ortho experience. I was president of my class, I had a handful of extracurriculars and leadership experience as well. So I applied and, of course, got 17 interview offers. I ended up going on 13 because of conflicts and ranked, I think, like 12, and ultimately didn't match.
Mm.
So I actually really pride myself on sharing this facet of my story because, it is incredibly important for students to realize that, listen, it's not an Instagram filter. It's not like a Snapchat, like filter to use. It's real life. That's the filter here, where I went unmatched and honestly had to figure out what was I going to do. Was I going to bail to another like specialty? Was I going to reapply? What was I going to do if I reapplied? Like, was I going to do a prelim year? Was I going to take a year off, do research? And the research component I knew was the biggest void. So to me, it was a no-brainer.
Mm-hmm.
But that being said, now I'm sitting there as class president in front of everybody looking at me with like puppy dog eyes, like, oh, like OMG, like you didn't match, like, like what happened? And of course, like, while their love and support were well appreciated, I knew that I still had a lot of work in front of me, a lot of work to do yet. So that's where I said, okay, I got to get down to business, and found myself a research opportunity locally at a pretty well-known institution. And then went ahead, did a research year, was super productive, and actually got really lucky that I was able to get so much onto my application as far as bolstering the research CV aspect of it all before I reapplied, about 5-6 months later after not matching.
Mm-hmm.
And that is probably far and few between. Not everyone gets a lot on their app right before they reapply, but I got lucky. And I'll tell you, so then I reapplied, and then of course, I didn't get as many interviews the next time around. The question came up multiple times, why do you think you didn't match? And then of course I matched, and the rest is history. But it's certainly really important to recognize that I learned so much about myself, about what I wanted, about my interest in orthopedics by not matching and then taking a year off.
Mm-hmm.
And I wouldn't trade it for anything. And I am really indebted to that sort of, challenge and hurdle and obstacle. That's actually made me stronger.
Mm-hmm.
So I share this very proactively with people because everyone's journeys from point A to point B, they don't always just go in a straight line. That's why you have to be flexible. That's why you have to not necessarily be rigid in your thinking about how you approach things, because you never know what kind of adjustments you're going to have to make. And it's okay. It's okay to stumble. It's okay to fall. But what's not okay is to not get back up. And that is the thing that I try to really share with your listeners, as well as, the kids that I work with day in, day out. And obviously the residents that, even when we're having a tough time with the case, it's like, listen, we pull every trick we pull every trick out of the book, and even come up with ones that are not in the book in order to make it work. And that's what we got to do, because that's ultimately what the end goal is to help patients. And so even if it meant not matching that time, okay, that's what it is. I've got work to do before I can take care of those patients I want to take care of. And so that really is probably what a lot of my advising and mentorship is in part predicated on, is what I went through myself. So I know the struggle, and I remember it vividly, and I hope that serves as a source, a little bit of solace, and sort of like in refuge when many of the students are worrying about the challenges that they're facing at this point in time, and especially for the fourth years right now.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10%, up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
Thank you for sharing that story, because I think that transparency is quite important a lot of our listeners out here, to be honest with you guys, some of you are not going to get into medical school on your first attempt. So keep trying. And some people may get into medical school and may not do well on certain exams or boards or rotations. And some people may not match. And it happens to a lot of people. And the thing about that is not falling into that depth of despair about this happened to me, but it's kind of figuring out your game plan of, okay, I made this pact with myself to become a doctor. I know I'm going to do it. People have done it before me. And you're going to figure out a way, whether or not it's through research or just taking that assessment and seeing what you can do better to improve yourself and get to that ultimate goal of becoming a doctor. You see a lot of physicians now, like their attendings and things, but we don't necessarily know everyone's story. And while everyone, when they become an attending or something, may seem like they didn't have any struggle, or your upperclassmen or even your classmates with you, everybody is going through something. It may not be the same thing, but it's about figuring out what will help you move towards and through your journey the best. So thank you for your transparency on that.
Yeah, I couldn't have said it better. I think that transparency is absolutely critical. And I think, this is one of the challenges in some of the social media, one of the facets of social media is that it's not always clear how how said person who you may admire got from point A to point B. And that line was many times probably not straight. It was probably a very, very topsy-turvy road. And that is actually why, at least in general for me, and this is just my own perspective, I really try to highlight the struggle, because the struggle is why I'm transparent about that in particular, because the struggle is in part where you learn the most about who you are. It's where you learn the most about your capabilities, and it's what allows you to grow the most. So you can make, improvements for the next time around, for whatever it may be, whether it's trying to apply to medical school, whether it's just trying to do surgery, a case better the next time, whether it's just trying to be a better friend, whether it's trying to be a better advisor or better, mentor or mentee, or just trying to be a better person. And I think that we are all learning from one another, whether we realize it or not. And I truly believe that when we're able to share the challenges that each of us is growing through, it makes it easier for the more junior folks to have, again, to kind of further develop their skills. So that way, and obviously, and have that information in their back pocket, so they can try to avoid the same, trials and tribulations. And of course, part of the process is going through going through those pitfalls, and and is falling and tripping and making mistakes, and that's part of life too, and that's important. But I do think that we learn, and I certainly learn more from the things that have not gone well than I do from the things that have gone well. And at least that to me is what allows me to stay grounded, allows me to, again, stay that much more connected with my patients, and really allows me to never become complacent, no matter what the accolades are or great news that's coming my way. It's like, hey, that's all wonderful, but it's like, listen, can we do better? Can I do better the next time for this patient, this situation, this family member, my child, my wife, whomever it is. And I think when we think in that context, then we're always going to be pushing ourselves to, again, just improve. And it allows us to also, again, as we said before, make adjustments that are necessary.
Couldn't have said it better myself. So you've mentioned a lot about your dedication and passion for mentorship. Can you tell us a little bit about Orthomentor?
Sure. So I first off have to give a lot of thanks and credit to the Orthomentor team, because while I may have sort of spearheaded parts of it, Orthomentor wouldn't be what it is without my co-founders and also the advisory board, in part because we've been able to, kind of really launch a bunch of different initiatives that have, gotten a lot of traction in general. So I want to give, a big shout out and a lot of credit to Dr. John Kaplan, Dr. Matt Baracallo, who are my co-founders. John was actually my co-fellow in Baltimore, and Matt, and now he's in practice in the Irvine area, Orange County area. And then, of course, there is Dr. Matt Barricallo, who is my former student when I was a resident, and who is now he's now an attending in sports medicine, generalist, orthopedic generalist in general surgeon in DuBois, Pennsylvania, where he grew up. And then, of course, there's the advisory board, which is made up of Dr. Bill Levine, who's chairman of orthopedics at Columbia University, Dr. Don Laporte, who is vice chair of education and program director for the Department of Residency program director for the Department of Orthopedics at Hopkins of Baltimore, and then Dr. Cara Cipriano, who is medical student liaison, education extraordinaire, and joint surgeon, oncology surgeon at Washington University in St. Louis. So the whole team deserves a lot of credit for everything that's been done so far. So Orthomentor itself came to life a couple years ago when John, Matt, and myself were discussing, how there really wasn't a lot of newer modalities for implementing kind of advising and mentorship. And so while mentorship may be a little bit more formally thought of in terms of, let's sit across the table, have super clear-cut goals, and like dedicated objectives, etc. Unfortunately, in this day and age, that can be a little bit challenging because everyone's busy. The sort of diaspora of kind of the folks who are the current generation super immersed in technology, whereas folks who are a little bit more senior may not be as technology focused or technologically savvy. That means that there is a little bit of there's a difference, there's a kind of a dichotomy of how to engage, how best to engage, especially when you need to engage on the fly many times. And that is in part where what really sort of got us thinking, well, we in ortho specifically, that certainly was there, and there was not a lot of robust advising for students in general. Now there have been a handful of like websites and whatever else that have been there over the years, but they've kind of waxed and waned in terms of how regularly they're being used. And of course, we wanted to provide information that was really quality and based on our experience, but also based on what's out there in the literature to an extent, but also based on what we have seen, gone through ourselves, and also observed in our own, kind of various institutions. So what started as, hey, let's just start by putting, kind of content on Instagram, because that is obviously a very common arena by which, medical students are engaging with each other and with others, eventually sort of blossomed into, let's get some of the attendings for whom mentoring and advising and educating and coaching medical students is really important. So we had reached out to the folks at Columbia, folks at Hopkins, folks at WashU, and they, without even batting an eye, said, "Oh, yeah, absolutely, let's get involved." And so we started, kind of developing more content via their contributions, via the contributions of not only online content from Instagram and social media, but also in terms of podcasts. And then in the more recent timeline, in the context of COVID. So there were a few of us, so Dr. Levine and myself and John and Matt had actually said, hey, there's clearly the students are not going to get a lot of information, from people now. Should we do something to kind of help this, knowing that, hey, this is actually going to be potentially problematic over the course of, hey, from the match timeline to right now. And so to up till now, in terms of how COVID is going to impact everything. So we actually set out to do a handful of webinars that were super well received, and it's gotten to the point where the webinars themselves are easily attended by anywhere between 500 to 1,000 people at a time. And our one of our peak webinar, which was what do we do without away rotations, that actually got 3,200 people on during the webinar, which is absolutely incredible, right? Just incredible. So we really took that to heart and said, hey, we're doing something good here. We need to continue this. So while the content on via Instagram has maybe slowed a very little bit. We have basically tried to ebb and flow in light of how students are consuming information right now, in order to make sure that we are staying current, staying relevant, and trying to really dial in what information is being required, what information is needed, what information is being asked of. And so trying to make adjustments by webinar based on surveying students we work with, interact with, mentor, advise, and coach on a regular basis. And so now Orthomentor has grown to be this thing where we've got it. I got students reaching out to me from all over the country, and sometimes even internationally, to really say, hey, how do I handle applying to residency? And this was in pre-COVID, but now certainly accelerated in light of COVID currently. So it's absolutely amazing, humbling, and breathtaking to just see the growth that has taken place over the course of even just the last 6 to 8 months, during this COVID pandemic. And I am honestly just humbled beyond humbled to be able to do this for these students, and to work with such esteemed faculty, both my co-founders and the advisory board, and then of course getting the faculty on the webinars from across the country. We've been lucky to have folks from Harvard to San Diego to NYU to Kansas to Minnesota, all, and then also the online, on Instagram, sort of program director interviews that we've been doing as well. So it's been a pretty large undertaking of sorts, but something that has, to me, I think it's been great for me to be able to do. And I think the response the students have had, to it, how receptive they have been, has also been quite incredible as well.
I have to commend your whole team on that, because it's a phenomenal undertaking. Not only, it's just amazing, how far we've come, where 10 years ago, people couldn't reach out and have these resources. They went to certain websites like Student Doctor and talked amongst themselves. Right. But to have this network of people advocating to help you do better and to help you find resources. And then on top of that, to add COVID into the mix, where there's so much that is unknown, to have that resource must be really reassuring and helpful for our students. And if a student wanted to reach out to you guys, how can they connect to Orthomentor? And are some of the previous webinars recorded where they can reflect back on them? Yeah.
So first off, regardless of whether you're in college or you're in med school or whatever year you are, you can always reach out. That is on Instagram at Orthomentor, spelled ORTHOMENTOR. And, I run the account. So if you send a message there, I respond to every message that comes through. We don't do medical advice. So if you're looking for, comments on an orthopedic surgery or whatever, I really don't provide that on there, but certainly could point you in the right direction, I suppose. But in general, it's really just for the kind of advising mentorship piece more than anything else. So my email address is tabsaiyer@gmail.com. And that's spelled T as in Tom, A as in Apple, B as in boy, S as in Sam, A as in Apple, I as in India, YER@gmail.com.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
So the Orthomentor Instagram page is certainly where there's a lot of content related, kind of applicable by year in medical school, kind of all the way from first year to fourth year. There's obviously hundreds upon hundreds of posts that you can kind of go through. The posts are constantly changing, kind of evolving based on things that people are asking me to, kind of talk about and asking the team to kind of bring up, which is obviously great. And we are obviously, the whole team is obviously cognizant of like, hey, what questions students have at any one point in time and trying to be responsive to that specifically. The other thing that's been happening of late is, as we mentioned, is sort of a webinar series as well, or webinars as well as an Insta Live series. The Insta Live series are interviews with program directors. And after every, and pretty much with the exception of one, because of recording and take, every recording of the Insta Live is put on YouTube. Instagram now has a function where the recorded Insta Live is put directly into the main Orthomentor, like as a post. So it certainly makes life easier in terms of it being right there. But I'm still uploading recordings of it to YouTube. And the YouTube channel is still just Orthomentor. And then, of course, we've got the webinars that we've done, and we put all the webinars on the Orthomentor YouTube channel as well. So so definitely all the webinars, all the Insta Lives, well, almost all the Insta Lives are all available there, with the idea of being able to go back and listen and see what kinds of responses, program directors, faculty members are giving to questions that are coming up.
That's great. There seems to be like a plethora of resources. So definitely utilize that. If someone tells you to reach out, definitely go to the Instagram page, click subscribe there, click subscribe here, and we'll be happy to give you lots of information as we get it coming in. What is one big change aside from not physically being able to go to interviews or that you've noticed that's going on in this 2020 cycle?
Yeah, I would have to say that probably the biggest change is just the fact that there's probably even more than before. The biggest palpable change is just, I think, how the anxiety that that a lot of students are facing now. And I think whether that's kind of because of COVID and the strain that COVID is mentally putting on patients, as it were, or on students, as it were, and on people in general. But then also just the notion of, hey, there's a little bit more uncertainty with regards to not being able to go to the hospital and rotate it, do away rotations. Then obviously not necessarily have the kind of physical interactions you might have of being at a given institution during, for an interview. I think the lack of those sort of normal social cues that we often really thrive upon as individuals and as humans, I think that is certainly something that is, the fact that we don't have that has created and evoked a lot more anxiety for students this time around. And I can definitely sense that amongst the ones I talk to. I think at least for ortho, there was sort of a universal interview release day. And I think just the way in which that was also done, which obviously was meant to help assuage anxiety, I think in some ways, unfortunately, created more anxiety. And so that has definitely taken a toll on students applying to specialties where that's the case, right? Not every specialty is doing universal release, but certainly of the ones that are, it's definitely not making it any easier. And of course, I think that, students just feel that there is a lot more like uncertainty than before. And that I think also kind of, parlays into the feeling of like just of nervousness associated with this process, which is already challenging as it were, right? So, I'm seeing a lot of these things and just trying to get students to understand that, hey, listen, y'all are talented people, y'all are, incredible individuals, and, no matter who you are, what you're applying for, where you come from, it's going to work out some way, somehow. And, you have to just keep your head up. You have to think about every strength every experience you've gone through, for better or for worse, and how it's added strength to your life, and use that as fuel. And it's always obviously easier said than done. But I say that as someone who has gone through a handful of challenges himself, including what we talked about earlier. And I say that because, listen, that's what's going to get you through that, kind of break through that nervousness, break through that anxiety, and just know that things are going to be okay. It may not work out exactly how you had hoped, but it will work out some way, somehow. And that, I think, is, something to take solace in. And if you can do that, then you're setting yourself up for, that much better a position to be in, no matter what the outcome is down the line. I think another big thing that students are having to do that they may not have had to do as much before is just how important networking and engaging and really reaching out to people around you has sort of reared its head as being. Mm-hmm. And it's because a lot of times you're relying on interactions and relationships you cultivate when you're rotating at various institutions. That is obvious. That's been obviated this year. So the other big piece is how do you connect with people who you've never met before, mm-hmm. and how do you try to convince them without being in front of them that you are, you've got what it takes to end up at that particular place. That's what's hard. And I think that it's causing everybody. It's truly a paradigm shift in how you have to sort of differentiate yourself, how you kind of really sell yourself, the kind of confidence you have to exude in order to really convince people that, hey, no matter what scores I have, no matter what grades I have, like I can do this. That I want you to see through all of that. And it makes it that much harder when you've got the additional lens of a computer screen separating you, right? Mm-hmm. So those are all a handful of things I at least think are, big changes that make it tougher this year. But, obviously these kids are incredible, and, I wish them nothing but the best, and know that, they're going to, do extremely well this cycle.
Absolutely. I really appreciate everything that you're doing in the realm of mentorship and orthopedics and all of those things. As we come to a close, my final question for you is, do you have one final piece of advice that you would give to someone who is in their very beginning of their journey, either applying to medical school or about to start their first year?
Yeah. Well, first off, thank you for having me. I do sincerely appreciate it. And, I think the piece of advice I would say is, take refuge in what you've done, mm-hmm. But know that even if you go through challenging times, that you'll get through them. And, if you're at the beginning of the journey, it's going to be tough, and that's okay. And that those challenges are designed to make you stronger. And if I could get through it, you certainly can too. I would also tell you that don't ever feel that you're on Lonely Island, because you're not. There's always people around you to support you, more senior, maybe same year or even more junior, who have a wealth of experience that can be very beneficial. Can be very beneficial to you just doing, to you accomplishing what you want to accomplish. And I think that the notion of mentorship is something that it's not just about, oh, hey, like email somebody and ask them to be a mentor. That's not exactly how it really, works. Mm-hmm. And honestly, it probably really shouldn't work that way if we're being frank. It really should be an organic, a relationship that develops organically, such that there is really, as I always like to say, bi-directional flow of info where you're learning from your mentor and they're learning from you. And it's almost sort of an unspoken, it's almost an unspoken relationship and bond that really gets forged. Because when in the true mentorships, at least in my mind, they develop into friendships. Mm-hmm. And that is where, so Matt, I would say is the kind of the absolute protege of that, because he was my student once upon a time. Now we're colleagues and friends. To the point he was in my wedding, John too. But again, I say that, listen, we always hear the adage of, oh, student becomes a teacher becomes a student. That's critical to our growth on both sides of that equation of mentor and mentee. And so the earlier you can start identifying those relationships, and the earlier you can start planting those seeds and really nurturing them, then the better it is in terms of your longitudinal success. And those are probably the few things that I would share with you, especially if you're at your pre-med, or you're thinking medical school, or you're thinking anything for that matter. All of this is critical, and it's critical to organizational success, period, no matter what field you're in. So just know that it's always going to be okay. And I personally will always respond to people who reach out. I tend to respond, and the last thing I'll say is don't ever hesitate to reach out to me, because I may need to direct you to someone else if I don't have like the ideal answer, but I will always respond, and usually within minutes. It's something I pride myself in, but I will always try my best to find you answers if I don't have them myself. So just one of those first steps, reach out and get started with mentoring and yourself involved with mentorships early.
Thank you so much for that. And with that, we're going to close. I definitely hope that our listeners are listening, and we'll definitely take you up on that, and definitely reach out to us if you have any more questions or any requests of any topics that you'd like us to cover on the podcast. Thank you so much, and I'll see you next week.
Thank you again.
Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.